Today is a very special day, a no tobacco day, which means that not only just the smoking, also any form of tobacco consumption is harmful to the body, and you should always discourage people who are smoking around you or chewing around you to, at least for today, so that it will be useful for them as well as for the next generation. So on this special day, the Lazarus Hospital group, we have started this hospital at Hyderabad Laktigapul 1.5 years ago and started today with this cancer block inaugurated by Mr. Bhagwant Rao, our Managing Director, State Bank of Hyderabad, with an exclusive facility and a special area dedicated for the cancer. The reason why we have to focus on the cancer is the last few years we are seeing that every family has at least one patient, if not more. And with that kind of incidence, cancer is known to be carried in families and generations. So we have to strongly discourage people who are smoking and also to encourage them to quit, because it is not a habit, it's a disease. So they just can't live without smoking, so naturally it needs a family support to help and also to make them forget that they're missing their fag. And especially for being the No Tobacco Day, and we have dedicating this cancer unit and being operational for today. So cancer always has three types of treatments. One is medicine, one is surgery, and the third is radiation. Cancer has its own variety or a method of treatments. So no single remedy or no single measure will cure all. So with that, what happens is we need to be careful in choosing which one is the better alternative. So we are still studying, and then our team, a group of the people, the tumor board, will meet for these cancers and see which is the best treatment. And coming to the radiation, radiation is a very effective form of controlling these cancer cells and tissues. So what we have today is a linear accelerator, which is a latest generation in terms of the radiation treatment. And in this, what happens is you measure exactly where the place of the tumor tissue is, and then plan it with the guidance of a CT scan, and make sure the same site, same cells are being radiated through the linear accelerator. That much facility is there. It is a most advanced system compared to the previous methods of treatments, where other tissues, neighboring organs, and the whole patient used to suffer a lot with the radiation and radiation burns. But with this treatment, it is very precise. Patients don't even feel that are radiated. Commonly, they are called it's a current treatment, they're giving the power. But these are the basic division of the electrons, protons, and neutrons, and which will get into the site of the tissue and the cell level, and then treat that. That we are proud to have that variant that is the #1 in terms of the linear accelerators in the world. And we are partnering. This is right now we are operating around 150 beds in this hospital, and today we have added another 40 beds with the cancer. So these 40 are going to be at least dedicated to the cancer. State Bank of Hyderabad, especially, we are happy with our bankers, and they are not just the bankers; they are our partners, and also help us in a kind of day-to-day administration, as well as giving us guidance and advice on which is the better form to make it, and also to reduce the cost and burden on the patient as well. Because indirectly, what happens is whatever is the interest payments or whatever is the cost of the funds, it ultimately boils down to the patients. But they are being very helpful to us to defer whichever is not necessary, whichever can be postponed, and they guide us, not just collect interest from us, but then they are not just the lenders; they are our partners and guides in the whole process. Yeah.